the decision of Shodhana or decision to go for Panchakarma versus maintaining or treating with just Shamana Aushadhi. So decision of Shamana versus Shodhana, how to take it, what are the factors to consider, where to go for Shamana, where to go for Shodhana, your thoughts on those?
So usually, very practically, I go with this. I first try to diagnose the condition and I try to understand whether it is Bahudoshaja Lingani, very clearly said. If there is a disturbance or the manifestation of the disease or condition which is having a copious increase or the abundant increase of the doshas which needs to be expelled out, then I feel if the person is having nidra nasha, atinidra, gaurava, staulya, so these type of lakshanas, if it is there, pidakas and oozing, and depending upon conditions, if it is in a profuse manner, if it is there, then I select that patient that he is capable or he should be suggested or subjected for Shodhana therapy. Next comes the play of patience. When I suggest to you go for the Shodhana, then the patient should be in a financially well and able to purchase that product or such service. Many times it so happens they are hesitant with the methodology, what we describe and what we do, how the Panchakarmas are done. They are reluctant to that. Second thing, many a times financial constraints definitely put them back on the things that they won't come for the Shodhana. So in such scenario, we may have to go for the Shamana. But if a Krisha patient is there, Alpa Balayukta patient is there, then but still the Roga Lakshanas are very prominent. He is a suitable candidate for the Shodhana Chikitsa, but his Bala is very much less. So in that type of patient are emaciated patients, in those we need to go for Sadhya Vamana, Sadhya Virochana, like that in a short duration, in a short span, we need to go for a repeated cleansing or Shodhana therapy or detoxification therapy. We don't want to go for a very classical therapy in those type of patients. This is what I usually adopting.
While giving, say, Sadhya Vamana or Sadhya Virechana, do you ask the client to come to your center or you try to manage them at their home itself?
No, the procedures are done on the basis of daycare facilities. I don't allow them to take these things at their home. They have to come at least for one day. On the day of procedure, at least one day they should be here. And because we need to check on the vitals, if something goes wrong, then it will be difficult to handle because patient will be somewhere else and we don't know what he has consumed, how much he has consumed. It is not monitored. So I don't allow that to happen. Usually we'll go for at least one day and a daycare procedure. We'll ask them to come and the things will be done.
Yes, and in a high-profile treatments like Vamana or Virechana, especially even if it is Virechana also, there can be so many things which can go wrong and we need to have a check on the client.
Definitely. Many times we will have excessive Vamana or Virechana if taken place, then we may land up in electrolytes and imbalance and all those things will come into play. And many times we need to give a little bit extra caution and some other alternative methods to overcome those things. Suddenly patient may have a severe cramping in the abdomen. So many things are there. Even sometimes while vomiting, Pittant Lakshana should be there and we need to stop there. But the medicine is continuously still acting and later the patient has vomited the blood also a little bit of it. So all these things happens. So that's why the reason that we need to be very careful in handling these detoxification processes. And of course, that is a quite challenging area, but it can be done in a very successfully and in a very systematic manner.